அனைவருக்கும் வணக்கம். இது உங்கள் SSR Pharma Media, your trusted source for pharma knowledge. So this is a game changer series in MCQs, Adrenergic agonist drugs part 2 and MCQ. So வாங்க வீடியோக்குள்ள போலாம். So last class and last video நம்ம இதில் பார்த்துருக்கோம். டோபமைன், டோபியூட்டமைன், ஐசோப்ரெனலின், டர்பியூட்டலின், பைட்டோட்ரால் இது வரைக்கும் நம்ம டிஸ்கஸ் பண்ணியாச்சு. தென் டுடே வீடியோவில் napazolone, oxymetazoline, xylometazoline, tetrahydrozoline and indirect acting hydroxy amphetamine. ஸோ இதை பற்றி பார்க்க போகிறோம். ஸோ இதுக்கு ஏன் ஆல்ரெடி நம்ம வந்து கேம் சேஞ்சர் அப்படின்னு நம்ம பேர் வச்சுருக்கோம் அப்படின்னா, ஸோ இந்த மாதிரி கொஸ்டின்ஸ் வந்து சின்னதாக ஒரு இடத்துல கான்சன்ட்ரேட் பண்ணாமல் படிச்சுட்டு இருக்கோம். ஸோ இதுக்கு இம்பார்ட்டன்ஸ் கொடுக்குறதுக்காக தான். ஸோ இது வந்து அப்படியே நமக்கு நல்ல மார்க்கை வந்து அப்படியே பூஸ்ட் பண்ணி கொடுத்துரும். ஸோ தட்ஸ் வை வி ஆர் கிவிங் தட் as game changer series, game changers. So போலாம் கொஸ்டின்குள்ள. ஸோ ஃபஸ்ட்டு sympathomimetic ANS, drug acting on the ANS, adrenergic agonist, direct acting napazolone. So first question, napazolone is chemically belongs to which class of compounds? Option A imidazoline derivative, option B phenylethanolamine, option C quinazoline, option D catechol. ஸோ இங்கே ஸ்ட்ரக்சர் பார்த்தீங்கனாலே உங்களுக்கு நல்லா தெரியும். ஸோ ஹியர் தட் 5-member ring containing 2 nitrogen atom, that is the 1 and 3rd position, that is called as imidazoline. So here there is one bond is backing, so that is called saturated nitrogen. So that is imidazoline is the right answer. So here imidazoline is based and alpha adrenergic agonist also. So the right answer is option A. So right answer is option A, imidazoline derivative, and napazolone is imidazoline based alpha adrenergic agonist. Enhance the receptor affinity also. So next question, napazolone is most commonly used for. So what is the use of napazolone? So here the options are A, increasing the heart rate, and B, treating the dry eyes, and C, nasal and ocular congestion, and D, decreasing the intraocular pressure. So napazolone is a topical alpha adrenergic agonist and causing the vasoconstriction in eye and nasal. So it's a medicine is used for the decongestant to relieve the red eye also. So here the right answer is mainly used for nasal and ocular congestion. So we will see the answer. Right answer is nasal and ocular congestion. Napazolone is a topical alpha adrenergic agonist causing the vasoconstriction used in the eye drops and nasal drops. It's medicinally used as a decongestant and vasoconstrictor added to the eye drops and relieve the red eye. So next question, direct acting oxymetazoline. So oxymetazoline also it comes under the nucleus is imidazoline nucleus. So we'll discuss the question. Which of the following is the best describe oxymetazoline receptor profile? Describe oxymetazoline receptor profile. So here that options are selective 1 alpha agonist, non-selective beta agonist, and partially alpha 2 and full alpha 1 agonist, and muscarinic agonist. So the right answer is, so it can go for that is alpha 1 and as well as in the alpha 2 also. So in alpha 2 it's a partial, here that in full of alpha 1 agonist. So here the right answer is partial alpha 2 and full alpha 1 agonist. Oxymetazoline provide the vasoconstriction in alpha stimulation, alpha 1 stimulation via feedback inhibition. So next question, prolonged use of oxymetazoline nasal spray may leads to. ஸோ ரொம்ப நாள் அதிகமாக எடுத்துகிட்டு இருந்தால் ஸோ என்ன ஆகும் அப்படிங்கிறதுக்கு கேட்குறாங்க. ஸோ ஏ இஸ் ஆஸ்துமா, இஸ் அட்ரோபிக் ரினிட்டிஸ், சி இஸ் அ ரீபவுண்ட் congestion rhinitis medicaments, and D cataract. So here that chronic use of that is oxymetazoline down regulation of that is alpha receptor due to that thing, rebound vasodilation and nasal congestion will occur. So rebound, that is, it leads to more than 3 days continuous use, and it result to rhinitis medicaments. And the right answer is option C, rebound congestion and rhinitis medicamentos. So answer is C, rebound congestion and rhinitis medicamentos. And explanation is chronic use of there is oxymetazoline causes the down regulation of alpha receptor, leading to rebound vasodilation and nasal congestion. So more than 3 days may result rhinitis medicamentosa, and recommended for limit use to 3 days. So this is a very important points. So next question is drug direct acting xylometazoline. So napazoline, oxymetazoline, and xylometazoline. So here that question is xylometazoline is primarily used for. So இது எதுக்காக primarily யூஸ் பண்ணுறாங்க பார்த்தோம். So A, bronchodilation, B, nasal decongestion, C, antiemetic therapy, D, hypertension. So it's mainly used for nasal decongestions, because xylometazoline also, that is alpha adrenergic agonist. So here that is imidazole nucleus only. So it's produce the same thing like a vasoconstriction and nasal mucosa vessels. So it's reduce the symptoms of nasal congestions. So answer is B. So xylometazoline is an alpha adrenergic agonist, produce the vasoconstriction of nasal mucosa vessels and reduce the symptoms of nasal congestion, allergic rhinitis, and sinusitis. So next question, xylometazoline is structurally similar to. So இப்போ இந்த ஸ்ட்ரக்சரை வச்சு நாமளே பார்த்துட்டு சொல்லிடலாம். ஸோ என்ன அப்படின்னா, that is a 5-member ring containing 2 nitrogen atom, that is a position is 1 and 3, that is imidazole. So here that bond, and this right answer is imidazole derivative. So this is essential for there is alpha 1 selectivity also. So next question, so it is a direct acting tetrahydrozoline. So which structural feature of tetrahydrozoline enables the alpha receptor activity? So same last question we have discussed about that. So option catechol ring with hydroxyl group, imidazole ring with lipophilic side chain, and that is the imidazole ring, then tertiary alcohol. So here that important thing is the crucial of alpha 1 activity, it's a lipophilic naphthyl side chain. So for receptor binding, so the right answer is imidazole ring with lipophilic side chain. So this is a imidazole ring. Already we have discussed about this. So right answer is B, imidazole ring with lipophilic side chain. So tetrazoline containing imidazole ring, and this is crucial for alpha 1 activity, and lipophilic naphthyl side chain is a receptor binding. So this is a most important point here, imidazole ring and as well as in the lipophilic naphthyl side chain. So next question, tetrahydrozoline relieves red eyes by acting on which receptor? So it's mainly used for relieve the red eyes, and so acting on which type of receptor? So நம்ம இப்போ பார்த்துருக்கிறது எல்லாமே அந்த ஆல்ஃபா அட்ரெனர்ஜிக் அகோனிஸ்ட் தான். ஸோ ஹியர் ஆப்ஷன் beta 2, alpha 1, muscarinic, and D2. So you can able to answer for this one. B is an alpha 1. So alpha 1 adrenergic agonist. So napazoline, tetrazoline. So answer is B, alpha 1. Tetrazoline is the alpha 1 adrenergic agonist, so causing the vasoconstriction to reduce the conjunctivity, to reduce the redness. So here, so I am giving the tabular column, easy to remember about this drug and receptor activity and clinical use, and what is the risk of thing. So which kind of receptor? There is a tetrazoline is comparatively alpha 2 more than alpha 1, that is more than alpha 1. Here also that is both alpha 1 and alpha 2. Then here that alpha 1 is a partial, and oxymetazoline is alpha 1 and partial alpha 2 agonist. So this tabular column will summarize, and it will be helpful for your preparation. And clinical use, tetrazoline is mainly used for eyes, eye redness and ophthalmic drops, and this also eye irritation, minor irritation, and nasal decongestion, oxymetazoline and xylometazoline. So mainly used for that. Then risk, there is a rebound redness and dry eyes and rhinitis medicamentosa. So this is repeatedly asking about that oxymetazoline, and here xylometazoline rebound congestions. So these are the important keynote points. You can just go through this one. You may get it. That is a question from competitive examination. So next drug for indirect acting, that is hydroxyamphetamine. So hydroxyamphetamine eye drops are primarily used in the diagnosis of which of the following condition. So A is acute angle closure glaucoma, B is Horner syndrome, C diabetic retinopathy and uveitis. ஸோ டி. ஸோ இந்த மாதிரி கொஸ்டின் வந்து ரொம்ப இதில் நான் நிறைய இடத்துல கேட்டதை நான் பார்த்துருக்கேன். ஸோ த ரைட் ஆன்சர் இஸ் ஹார்னர் syndrome. ஸோ இட் இஸ் த மெயின்லி used ஃபார் testing of this Horner syndrome. So localize the lesions and it causes the mydriasis only, and postganglionic neuron is an intake. So by releasing the norepinephrine release from sympathetic nerve terminal. So we will see discuss the answer. So it's a main that is answer is B. So hydroxyamphetamine is a diagnostic test for Horner syndrome to localize the lesions, and it is cause the mydriasis only if the postganglionic neuron is intact. By releasing the stored norepinephrine from the sympathetic nerve terminal, so this lack of dilation suggests that postganglionic lesions. So here two things we are going to use for the diagnostic use in the Horner syndrome. The drugs are hydroxyamphetamine and phenylephrine 1%. The main mechanism indirect release of norepinephrine is a direct alpha 1 agonist, direct release. So here that we can able to differentiate the pre versus post ganglionic. But in case of phenylephrine confirms the post ganglionic lesion, that is via very hypersensitivity. So these are the very important comparison. So next, propyl hexidine structurally related to which of the following drug class? So A catecholamine, phenylethylamine, imidazoline and xanthines. So here you can able to see that phenyl hexidine that is so it's you can see that that is a cycloalkyl, that is a cycloalkane group of amphetamine, belongs to the family. So it is and also here phenyl group, then ethylamine. So this is an ethylamine group will be there. So here the right answer is phenethylamine. The right answer is phenethylamine. Propyl hexidine is a cycloalkyl analog of amphetamine. So this is a very important point. So it's a cycloalkyl analog of amphetamine which belongs to the phenylethylamine class. It is a lack of hydroxyl group, making more lipophilic and resist to the metabolism of COMT. That is a catechol orthomethyl transferase. So end of the video வந்தாச்சு. Here the tetrazoline, naproxeline, oxymetazoline நம்ம பார்த்துருக்கோம். ஸோ இது எல்லாமே belongs to which structural class of that is found in the topical antagonist அப்படின்னு கேட்குறாங்க. ஸோ imidazoline class and catechol and phenethylamine, and that is xanthine. So I'm giving that idea regarding with this. Here that is a 5-member ring containing 2 nitrogen atom, that is 1 and 3 position. So you can இப்போ ஆன்சர் நீங்கள் கண்டுபிடிச்சிருக்கலாம். ஸோ யூ கேன் ஜஸ்ட் ஆன்சர் இட் கமெண்ட் பாக்ஸ். ஸோ நெக்ஸ்ட் திங், யூ கேன் ஜாயின் அவர் WhatsApp community group. You can get the handout material. So it's ideal for the pharma competitive all the exams, and just attend the test series so you may check your knowledge. ஸோ இந்த வீடியோ உங்களுக்கு பிடிச்சிருந்தா just like it and share your friends so most people benefits, and kindly subscribe. Thank you. இது உங்கள் SSR Pharma Media, your trusted source for pharma knowledge. Prepare, practice and succeed. Thank you.